The next category of drugs we're going to talk about as an antiemetic. Emetic is the category of cannabinoids, and these are talked about on page 247, and they are discussed in the table on page 244. Now, it's been known for a long time that marijuana, smoking weed, can cut down on the nausea and vomiting of chemo. And it used to be that chemo patients would, send friends and family members or go out themselves to get pot so that they could smoke it for their chemo. And they took all the risks that you take when you're finding illicit drugs. Now they have synthetic cannabinoids. And the prototype drug for this is a drug called dronabinol or Marinol. And I have seen this given mostly to the elderly with dementia to increase their appetite. What the cannabinoids do is to reduce nausea and vomiting by binding to cannabinoid receptors in the chemoreceptor trigger zone. Yes, we do have cannabinoid receptors in our brains. And to kind of keep serotonin from binding to those receptors. So it sort of blocks, it binds to cannabinoid receptors and blocks serotonin receptors. And therefore it relieves severe nausea and vomiting. So you can give these drugs naturally in smoked form or vaped form or in brownies. If I was ever going to take that, that would be my method of choice. Or they can be given synthetically. So most of the time, if the drug is taken according to directions, you're not going to get that high necessarily. You will get the side effects of decreased nausea and vomiting, possibly increased appetite, without getting the side effects that you might not want. Now, you can get a dose-related high, and you might be able to spot this because your patient is very, very happy, seems to be aware of everything, and is very giggly. You can see this. That's just a side effect. However, adverse effects are confusion and seizure-like activity and allergic reactions like anything else. Supposedly, the states that have legalized medical marijuana are seeing more and more emergency room admissions with this seizure-like activity and acute confusion just because of the adverse effects that can come with the cannabinoids. Drug interactions, you want to avoid grapefruit juice. Don't wash your Marinol down with a big glass of grapefruit juice. And any drug that increases the sympathetic nervous system, because you are affecting serotonin, you are blocking these serotonin receptors and stimulating the cannabinoid receptors, you can run into problems with the central nervous system. On page 247, we see patient and family teaching for the cannabinoids. Usually they're going to save these drugs for when the patient hasn't responded well to anything else. It's given according to body surface area, so both height and weight is taken into account so you don't overdose somebody. For liquid Marinol, you want to use an appropriate measuring tool. Don't just splash it out in any old soup spoon. Use a calibrated medication tool. Avoid central nervous system depressants because cannabinoids are themselves a central nervous system depressant. Watch for changes in mental status, and you usually know what kind of changes those are. If the person gets very mellow, very giggly, very happy, it's probably working okay for them. And like I said, it's often given to older adults to increase appetite along with relieving nausea. That's an effective medication. Let's look at page 248 and promotility drugs. And in the table on page 244, we talk about drugs that increase GI motility. And our prototype drug is a drug called metoclopramide or Reglan. Now, Reglan blocks dopamine receptors in the chemoreceptor trigger zone. So it helps with post-op nausea and vomiting, chemotherapy-induced nausea and vomiting. And then sometimes the really, really upset stomach you can get from having too much stomach acid that's backing up into your esophagus. The side effects you can expect to see with a drug like Reglan: drowsiness, fatigue, restlessness. It can interact with or interfere with sight, probably by dilating the pupils. Urinary incontinence or insomnia. Excuse me. Now, in severe cases, the adverse effects can be depression and suicidal ideation. Very rare, but some people, the Reglan, especially in continued doses, it just does not really agree with them. And so you want to watch for that. Drug interactions, it can interact with phenothiazines. Remember how we said cardiac problems? Typical and atypical antipsychotics, because they're also affecting dopamine. And then levodopa-carbidopa, which is trying to allow more dopamine to get into the brains of Parkinson's patients. For patient and family teaching, that's found on page 248. You want to monitor older adults. They can get confused. They can fall. Because we are interfering with dopamine, you want to monitor. I have old adults. It doesn't sound nice. It's supposed to be older adults. Monitor them for Parkinson's-like symptoms or unusual facial movements. If you see anything that looks like pseudo-Parkinsonism, you want to hold that med and call the healthcare provider. Watch for orthostatic hypotension. You want to give these drugs 30 minutes before meals and give them at bedtime. That's when you are kind of going to have an increased potential for nausea. If you see depression or any kind of suicidal ideation, hold the med and call the healthcare provider. In box 13.1 on page 245, we see a nice long blue column of the general nursing considerations, things that every nurse should know when you're giving these antiemetic drugs.